Hello friends, today Chai Pe Charcha is basically regarding the discussing about a brief introduction for the grand scientific session arranged by IDA Dombili branch on 28th and 29th of October in Dombili called Prosto Symposium 2023. As you all are aware and you are a dentist, complete denture is basically a bread and butter of our dentistry. And to talk about basic as well as advanced in complete denture procedures, we have Dr. Amit Sadhwani, who is an eminent prosthodontist and who is going to enlighten us about the procedures which can be adapted by a general dentist. This program is meticulously arranged in such a manner that you will get to learn about how to grow your practice also. I am very happy and honored to introduce to you my classmate, a very good prosthodontist and an eminent practitioner from Dombili, Dr. Nitin Bhat, who is going to talk about his journey of prosthodontist as well as do's and don'ts in dentistry by the general practitioners. I welcome Dr. Nitin Bhat on today's session of Chai Pe Charcha. Welcome Dr. Nitin, over to you.
Thanks, Mohan, and thank you again for the kind introduction. Congratulations, IDA, for hosting Prosto Symposium 2023. And after graduation, I joined prosthetics, MBS in prosthetics. At the same time, I started practice. And the first thing that we were taught during college days is, if dentistry is your bread and butter, maybe you can have cheese, jam, and everything on it, provided you practice prosthetics nicely. And prosthetics is what gives you the maximum chunk of your earnings in your practice. And different branches of prosthetics like complete dentures, removable partial dentures, crown and bridge, and now for past almost 3 decades or 4 decades, implantology has always attracted big attraction of general dentists as well as the specialist. Also the local population, the general patients who come to us, maybe 50% of them, they come for replacement of their teeth. And that is where prosthetics is actually the cherry of dentistry. And as IDA has planned out this year prosthetic symposium, the first topic probably is the complete dentures. Well, I know Amit Sadhwani for quite some time. He regularly conducts courses for complete dentures. So the first time when I heard about courses for complete dentures, I was really surprised and happy, because there is somebody who is talking about the simplest of all procedures, but yet the most probably important and something that is different for every patient. Because it's very difficult to make a complete denture patient happy. And here is Dr. Amit Sadhwani conducting courses for general dentists about how to make a patient happy with a normal complete denture procedure, and then the advanced, maybe using the technology right from scanners to digital printing of dentures. So I would appreciate that all of you please attend, and it's going to be an eye-opener for me as well. In spite of practicing prosthetics for the past 35 years, there is always something new to learn from junior colleagues. And I have always realized, and I follow the principle, that the only way to survive is to learn. Learning should never stop. Mohan.
Thank you, Nitin. This is a brief journey he has talked about. He has been having a big journey where from he has advanced from a normal dentistry to a specialist in implantology in Dombili. He was the first person to start implants practice in Dombili, and I am really happy for him that he has grown up so much that today he is considered as one of the topmost speakers also in implantology. Well, as you said correctly, if complete dentures is the bread and butter of dentistry, it is the cherry and jam which everybody aspires to be. And implantology, I think, is the cherry and jam which the person wants to get in his practice. Again, we have another speaker who is Dr. Sujit Pardikar, who is going to speak on implantology. And I think you must briefly tell the general practitioners who want to start his implantology practice do's and don'ts about the implantology, because do's many people tell, but don'ts nobody says. and that is where the failure comes. So please enlighten the general dentist about the implantology practice.
Thank you, Mohan. As all of us are aware, implantology is, I won't say future, but it is the present of dentistry today. And when I started, I placed my first implant way back in 1996. Things were different. Patients would run away with the moment they came to know that I am going to put a screw for putting an artificial tooth. Today we have patients who are very well read, very well informed, come and asking not only for implant but for a specific company. So they are very well prepared. So this is one branch which should not be limited only to specialists. I believe a specialist is one person who aspires to become a specialist. It's not the degree that makes the difference. It's the knowledge and the practice. Continuous zest to learn. So we all are prosthodontists, we all are oral surgeons, we all are periodontists. So even a general practitioner should know and start the implantology, because we as prosthodontists or periodontists and oral surgeons cannot reach the demand that is there today for implants. So I sincerely feel that every dentist should and must practice implantology. Now coming to implantology, Dr. Sujit Bopadikar, he is junior to me. I know him for a long time. We were in a teaching institute together and he's been an excellent teacher. I have personally attended his course one day and I know him for a very long time. He has the zest to spread the knowledge of implant dentistry and he's an excellent teacher. I am saying this because there are some people who are very good clinicians, but they are not good teachers. But he is both. He is a good teacher, he is an excellent clinician, and he has been promoting implants for more than a decade in his courses, as well as speaking on international and national podium. Now the topic that is given to him, the only thing I feel is time. He has good amount of time constraint, and implantology is such that you will keep learning throughout your life, and that's so as goes true with dentistry, that the education doesn't stop. But I feel this is something good because simplified, implantology simplified is, it is for people who are beginners, who want to start, take a first baby step. So I feel this lecture is going to enlighten you all on how to start your implant practice. Take one baby step at a time. Maybe do overdenture cases, ball and socket overdenture cases to begin with in the area where it is very safe to place implants, especially anterior mandible, and then go on to little more complicated cases, single tooth and then full mouth cases. So as I say, because the time that is limited, but I am sure knowing Sujit, he is going to do justice to the time. He is probably going to talk about occlusion also, which is an important factor because most of us, I will tell you about myself, when I started placing implants, it usually used to be on a Sunday because we wanted to keep exclusive practice, so that it used to give us a great feeling that I have placed one implant today, and something sometimes we would take 2 hours. But then I realized I am not doing justice to my patients and I am not doing justice to myself, because I had to cut down on my family time and I had to cut down on my rest time. So implants is a day-to-day practice today. Every day is an implant day. But those days, surgery was glorified. You place an implant and you used to get high. We never talked about prosthetics. But as you all know, patients don't come to us for implant. Patients come to us for a tooth. And the only way we can place tooth is on the implant. So surgery was glorified in the early days. But today, if at all, I say this and I am not wrong in saying this, all implants are successful till the time they are loaded. The failure comes only after loading the implant. And that is where a prosthodontist or prosthetic knowledge, I should not be saying a prosthodontist anymore because we all are specialists. So a prosthetic phase of the implant is very, very important. I am happy that IDA team, Dr. Lalit Patil, Dr. Kamet Chaudhary and the scientific community have realized this and kept only prosthetic part, because surgery is something you can probably learn, but the nuisances of prosthetics, right from taking impressions to taking jaw relations, to deciding whether it is screw retained or cement retained, selection of abutments should not be left to the laboratory. We all clinicians should decide beforehand and then proceed with the case. As they say, plan so that you can have a successful implant procedure and not the other way. Okay, so I am very happy and I invite all of you because I am going to be there and there is a lot to learn from Sujit. Recently at ISOI, his lecture was probably the most applauded lecture on crestal sinus lift. And I feel I'm so happy that he's coming to Dombili. You could find time to come to Dombili, make use of it because this is something you're going to miss out if you don't attend. Mohan.
Thank you, Nitin. All of you must have realized now why Nitin is a successful implantologist. If you have realized how much he thinks before putting an implant, he is thinking about how to make a processes of it, how to give a good occlusion of it. And it is a good thing about Idea Dombili that they have kept the topic of simplified implantology because everybody cannot be an expert right from the beginning. And as Nitin has said, all of you must take advantage of this session which is organized by Idea Dombili branch. Along with that, the more attractive part, another attractive part of this session is going to be how to grow your practice, which is going to be spoken by our very own Dr. Chilgupi. Along with this, now you all must have made your mind that you must attend this session in Dombili on this Saturday and Sunday. The registration details and the brochure will follow at the end of this video. And welcome you all. We are all eager to welcome you for this scientific session. Thank you very much, everyone. Thank you very much, Dr. Nitin. And thanks to DIDA.
One, I must add, there is another attraction by Dr. Rajiv Chitgupi. He's going to talk about marketing, and believe me, unless and until the patient says yes to your treatment plan, you are not going to make money. You are not going to make the patient happy, and that is where Rajiv has excellent experience. He's been editor of Asia Pacific Dental News. He is in teaching, and his talk is about MBA. So please be there because you may be one of the finest clinician, but unless and until the patient agrees to your treatment plan, it is of no use. And that is where I am sure Mohan also will agree because today I am so happy that there are people who will tell you how to market dentistry. When we came into dentistry, I started almost 35 years back. Mohan probably started the same time or maybe a little earlier. And believe me, nobody told us about marketing. Marketing is the key today. Your product may be great, but unless and until you market it, it is not going to be a successful venture. So another aspect, and I am so happy because I may be one of the finest implantologists, but who cares? If the patient doesn't say yes to my treatment, of course M pays for it. So be there. There is another topic, MBA, that is marketing, how to market your practice, and who else could be better than Dr. Rajiv Chitgupi to say, teach us all that. So please be there, get the most of it. I am sure it's a big weekend that you're going to, probably be away from your family members, but believe me friends, it's going to be worth. And another thing is, do attend the banquet. That is where we're going to change and, talk about ourselves, change and exchange thoughts. So thank you, Bina, for arranging one of the finest symposium it's going to be. So don't miss out. Thank you.
Thank you.